Species-specific reactivity refers to the distinct responses that are prevalent within certain biological groups, shaped by their shared characteristics. An illustrative example of this phenomenon is observed in the differing health responses exhibited by men and women towards various diseases. Furthermore, individual reactivity demonstrates substantial variability among persons, influencing their responses to diseases or immunizations. While certain individuals may endure severe reactions, others may remain largely unaffected during periods of epidemic illness, showcasing this diversity. In the realm of immune function, physiological reactivity occurs without disrupting the body's homeostasis, in contrast to pathological reactivity, which can precipitate illness. This distinction is of paramount importance for comprehending immune responses and devising effective treatment strategies. Notably, phagocytosis is underscored as a fundamental component of the immune response, illustrating the active measures the body undertakes to combat infections. This process is crucial for maintaining overall health. Moreover, passive immunity is acquired through the administration of vaccinations, which prime the immune system to recognize and combat specific pathogens. This highlights the significant role that vaccines play in promoting public health. Cell-mediated immunity is particularly potent against viral infections, with T cells serving as crucial agents in this mechanism. Gaining a thorough understanding of this process is essential for the development of targeted therapeutic interventions against viral pathogens. Within the framework of cell-mediated immunity, killer T lymphocytes are primarily involved, responding to an extensive range of antigens, including viruses and tumor cells. This cellular defense mechanism is vital for protecting the body against various threats. Conversely, humoral immunity operates through the production of antibodies within the bloodstream that specifically target bacteria and foreign proteins. This mechanism remains critical for the body's defensive capabilities against infections. When humoral immunity is compromised, individuals may experience specific infections, such as bacterial pneumonia. An understanding of these connections is instrumental in facilitating effective diagnosis and treatment strategies. The significance of barrier factors cannot be overstated, as they contribute fundamentally to immune resistance and reactivity. These protective elements can profoundly influence the overall immune response to pathogenic incursions. Physiological reactivity embodies the body's normal responses to stimuli, whereas pathological reactivity denotes a malfunction in these responses. Recognizing these distinctions is essential for identifying appropriate treatment approaches. The immune system can exhibit both normal and pathological reactivity, which significantly influences its response to diverse stimuli. A comprehensive understanding of these classifications is critical for advancing immunological research and clinical practice. Excessive immune reactivity often presents as allergies, which constitute a considerable category of diverse pathological conditions that demand vigilant attention and management. Conversely, insufficient immune reactivity, characterized by immunodeficiency, poses severe health risks. This condition results in a diminished capacity of the immune system to effectively respond to antigenic challenges. Antigens occupy a crucial role in the immune system's ability to maintain homeostasis. Recognizing both common and specific antigens is essential for ensuring a properly functioning immune response. Alpha-fetoprotein serves as a vital diagnostic marker for liver carcinoma and various other malignancies, underscoring the importance of identifying specific antigens for effective diagnostic procedures. Exogenous antigens can pose significant threats to antigenic homeostasis, potentially resulting in allergic reactions and an array of immune responses within the body. This dynamic illustrates the complex interplay between external agents and immune function. Additionally, endogenous allergens, which are produced internally, can also influence immune responses, particularly in sensitive tissues such as the testis and thyroid, which traditionally enjoy protection from immune reactions. The inflammatory response facilitates increased permeability, enabling immune cells to infiltrate tissues, albeit with the risk of damage. This observation underscores the critical need for maintaining barrier integrity within the immune system. The repercussions of immune deficiency encompass heightened susceptibility to infections from both pathogenic and conditionally pathogenic microorganisms, potentially leading to serious health crises. Awareness and early intervention are crucial in mitigating these significant risks. Congenital immunodeficiencies, such as severe combined immune deficiency, result in the absence of both humoral and cellular immunity, necessitating stringent isolation measures and advanced interventions, including bone marrow transplants. A comprehensive understanding of these conditions is vital for robust patient care. Moreover, graft versus host reactions may arise when foreign immune organs are transplanted, leading to the new organ attacking the recipient's body. This scenario illustrates the intricate complexities of immune responses that must be navigated in transplant medicine. Immunodeficiencies exhibit varying degrees of severity, with some resulting in significant health challenges. Therefore, comprehending the different types of immunodeficiencies is essential for effectively managing patient care. Lastly, class out immunoglobulins play a protective role in safeguarding infants, particularly against gastrointestinal and respiratory infections. Their presence is instrumental to the health and well-being of newborns.